to celebrate our New Bedford International Overdose Awareness Day. Today's our 5th year doing this in New Bedford. We're so blessed that you're part of this. You know, when we celebrate this day, we celebrate those that, you know, are still struggling with addiction. It's really to bring about, you know, stigma. Let's talk about stigma. Let's really diminish that. But let's bring awareness. We're very fortunate in the city of New Bedford that we have such great collaboration throughout the departments, but also individuals like you who support our cause. We are a city of hope. Last year in the state of Massachusetts, we lost almost 2,100 people. 2,100 people were lost in the state of Massachusetts. In New Bedford, we lost 40 individuals to overdose. 40 individuals that belong to a family. Their family changed dramatically. 4 individuals might have lost a parent. They were somebody's sister, somebody's brother. They were probably your neighbor. They were probably your child. So today, we come here to really remember those who struggle with addiction, but also we call upon you to be a voice in your city. We live in this beautiful city that brings so much. We work so hard to bring this beauty, the beauty that we have into the city, but we still need to come together. We need you to educate our children who are young about this disease, because it is a disease. We're losing families. We need you to call upon our government so they can help our city, put in more programs in schools, put more people out, you know, doing street outreach. We need people like you to advocate for more treatment and recovery. We need voices. We need voices. We need you, and we continue to appeal to you. The people behind me are the ones that have been behind this cause. So we ask you, the public, just stand high, take pride in your city, look around. You could be the voice that's going to save somebody's life this year. Our numbers keep going up, but it's not because we're not doing great work. It's because we still need people like you to begin to speak, to begin to have a voice. So today, we have great speakers that have been part of this project, leaders in our community, leaders not just in cities, but also up at the State House. But first, I would like to call well, actually, first I would like to acknowledge the committee who put this together. I couldn't do it without them. You know, I come up with an idea and suddenly, you know, they're like, all right, well, all right, Connie, just go ahead and do it. David Lima, Reverend Lima is like my right hand. You know, I want to thank him so much. Pastor Jamie Casey, you know, today I still send them out to do things. You know, Carl Alves, you know, who's been there for over 20 years with me on this. So, you know, my friend April from the District Attorney's Office, you know, she's just been wonderful being able to support and being out there promoting. I know Stanley is here from Community Connection. I know he became part of this group this year, really just being, and I want to see where my friend Megan is. Come up here, Megan. So Megan works for Clean Slate, and I do have to tell you that she is a big part of a lot of the initiatives that we do. If we have a problem to get somebody into treatment, you call Megan and she'll get them the next day there. So, you know, these are the people I want to thank for not just helping put this together, all of us, but also when throughout the 365 days a year, they're there to help us out. So you see these individuals will have also the City of One. And I'll let the chief talk about that, the symbol, the City of One, because we are a city of one. We are united. We are a city that gives out hope. So that's what we're hoping to bring today, is hope to those who struggle and those who continue to struggle, but also hope to those who have lost someone. And of course, you know, we want to thank this wonderful band that's here today, who has given us so much joy already and will accompany us. So for the opening, it is my pleasure to bring the one and only Reverend Lima to do a little blessing so we can open our program.
If we'd bow our heads, please. Lord, as we gather here this afternoon, we just want to first thank you for all that you do to help us. Our faith is what can carry so many of us, and it's our faith in the Lord that can help us to overcome so many things. It's also a lot of people with a lot of faith, both in the church and outside, that continue to work knowing that sometimes the tide is just rising and it's coming and it's cresting, and we think we can't make a difference, but we can, even if we only do it one person at a time. We thank you, Lord, that you are present with us. We'd ask you to bless these proceedings and to bless all that are hurting because a loved one is gone or has suffered overdose and continues to struggle. We lift up these families and we surround them with love and respect, and we say you're not alone. You'll never be alone. We're here to help. We thank you, Lord, for this in Jesus' name. Amen. It has been my privilege to work with this group, and I'm going to be introducing the speakers. I've also, you know, whenever we have speakers, we're always concerned about how long they're going to go. So they always think that the Reverend's bulletproof, but he's not, because everybody right now is thinking bad things about me. But knowing that it's hot and humid, we're going to ask the speakers, who we are all vital for the work and the success that we do in this community, to please keep it relatively short, because I've asked the Massachusetts State Police pipes and drums that if you start going too long, like the Oscars, I'm going to wave and they're going to start playing. And there is no starting low and ending high, it's just high, okay? So with that being said, we do want to call up Mayor Jon Mitchell. His Honor has led the fight in the community, has called a lot of people together, is put resources in departments like our health department head, Damone Chaplain, to really spearhead an effort in the city. So I'd like to invite and please welcome the Honorable Jon Mitchell.
All right, Reverend Lima, I will I'll take that not so subtle hint about brevity and I'll get right down to it. I'm here for a couple of reasons. One is I want to say thank you. I want to say thank you to the team, and I mean that in the most fundamental sense. Our fight against the tide of opioids here in New Bedford has been a team effort, and we do it as well as anybody in America. Ask the folks at the National League of Cities, where we were invited among 5 cities around the country to tell everybody else how we're doing it. It doesn't mean it's going to be an overnight success. It doesn't mean it's easy, but it does mean that we've got the right folks in the room who are making it happen and who are devoting themselves to the cause and are making wise decisions. And it should give us confidence that we're going to make progress, because we have to. It's not just a matter of life and death in the generic sense. It's all about very real people. People we know, people we love, people we're related to. And there just have been too many. And it's not as though New Bedford is unique in this way. Of course, we're not. There are many communities around the United States who have it far worse off than us in that way. But it's been bad. It has been bad, and we have to understand, and I don't need to tell anybody that here, but we know that we're making a dent, we're making progress, and there's no time like the present. And I'm glad folks brought pictures of their loved ones today. I think everybody should take a look, as though we need, not that we need reminders, but we need inspiration every day, because the work is indeed hard. But we will persevere day after day after day until we get things under control. I want to thank, in particular, some of the team members, of course, David and Connie, of course, for being at the tip of the spear, the folks in city government, our police chief, our health director, Damone, Chaplain, Joe Cadero, of course, from whom you'll hear, everybody from PACA, from every organization in the city that's been involved, South Coast Health, everybody, way too many to name, and it is way too many to name because it has to be that kind of effort. The task force that we created a couple of years ago has worked very well as task forces do, but nobody's under the illusion that this is all going to be fixed quickly. Keep at it. Let's keep at this. We're making a difference, and we're going to be out there with you until we've got it, until we've done the job. And so, thank you everybody for being here tonight. Let's continue to spread the word and make the effort real. Thank you.
Next, I'd like to bring up our District Attorney, Tom Quinn, who has done some tremendous work both in law enforcement but also in looking to see how we can work together and make a difference. Tom?
Thank you. The purpose of this event is to recognize those who have lost their battle with addiction and those who continue to struggle. With so many lives lost to this disease of addiction, the District Attorney's Office has made it a priority to provide education and prevention opportunities across Bristol County that reach parents, students, and the community at large. Hopefully, as a result of our presentations in schools and our hidden in plain sight mock bedroom display, teens are able to make well-informed decisions about any substance they choose to put into their body. Parents are being empowered to create open dialogue with their children about the dangers of drugs and alcohol and how devastating the consequences of becoming addicted can be. Additionally, our office is taking the lead along with South Coast Hospitals to create and strengthen the Bristol County Regional Alliance. The purpose of the alliance is to bring together talent and experience from around the region to better address the greatest public health problem of our time. With everybody working together, we can make a difference to end this scourge that has afflicted many people in our community. Thank you very much.
Thank you, DA Quinn. Truly a partner in this effort. Somebody who does the work up at the State House, who continues to try to get funding down here for us to be able to do the work and create the efforts that to fund some of the efforts that are being done. There's never enough funding. Anybody who's worked with this knows that. But there are things that can be done, and Representative Tony Cabral has been one of our biggest heralds, and so we'd like to invite him to the podium, please.
Well, good afternoon, and it's nice. Let me first begin by thanking all of you for being here. It is because of your engagement and your involvement that we're going to be able to win this fight. And I'm glad to see so many of you. I'm glad to see the pictures of loved ones. Your willingness to share your stories. Your willingness to sometimes those stories are painful stories, but they really help the community focus and stay focused on this epidemic. So thank you again for that. Now, as the old saying goes, addiction does not discriminate, right? You know that. Doesn't matter who you are, what's class, poor, rich, white, black, brown, it doesn't really matter. Because this is the kind of epidemic that affects almost every family in this community, almost every family in this state. You know, and the only way we're going to be able to win this is by coming together, getting involved, and taking this fight on, just really working hard and taking it on. Let me tell you briefly some of the things. I know we have a short program. I think I've been over-prepared, but I think there are a few things that are important to really talk about, make people aware of what we are doing, both at the community level, both at the State House, to really begin to win this fight. And by making you aware, I think we're going to be better off. Just recently, this past July, we passed another piece of legislation around opioid prevention and treatment. That was passed just this July. A couple of things that are very important on that piece of legislation for everybody to know is allows pharmacies to dispense Narcan to the general public without a prescription from any medical person. Mandates that emergency rooms and Section 35 involuntary commitment facilities provide medication-assisted treatment, including methadone to treat withdrawal symptoms, and Vivitrol to prevent relapses. Creates 5 pilot programs within the House of Corrections across the state to help low-level offenders address their addiction problems before they return to society. And as you know, most of these folks don't serve more than 4 to 6 months on the House of Corrections. They're coming back to our communities. They're coming back to our families. They're coming back to be productive members of our society. The only way to do it is to make sure when they come back, they are on their way to recovery. Unfortunately, the Bristol County is not one of them. Well, I'll leave it at that for you to think about that. Let me also thank the city, the health department, the mayor's office, Chief Cordero, and the entire Greater New Bedford Opioid Task Force for the great work they've been doing over the last couple of years to really bring everybody together. Connie and the entire team today, and really all of you, because without your involvement, we can be here, but we're not going to be able to solve it. So thank you again. Let's keep together. Let's fight together, because we're going to win this crisis.
I'd also like the President of the City Council, Linda Morad, who's been doing this kind of work, leading things in the city and bringing things to our attention for so long. Linda?
Thank you, Reverend Weaver. Good afternoon, everybody. Thank you all for being here. I just want to address my comments on behalf of the New Bedford City Council to those of you who are doing the job of trying to prevent opioid addiction and overdose deaths in our community on a daily basis. You don't do this for any reward. You do this because you care about our city, my city, and the people that live in this city. And I know this isn't easy work. To the men and women that are in our public safety areas, and to our emergency room staff, our doctors, etc. What you see on a daily basis and how you try to help those that are in need in our community, I commend you, and my colleagues commend you for your work on behalf of the people in our city. This isn't going to be solved overnight. It didn't begin overnight, but you've made such great strides over the short period of time that you've been together as a task force, working hard to help those families in our community that have either lost a loved one or who are suffering through an addiction in their community, in their household. So I thank you all very much for what you do. I encourage you and I support you in your efforts going forward. God bless each one of you, and hopefully there'll be a day when we won't have to have these types of press conferences or these types of gatherings. And if we do have them, they're to celebrate the fact that we've made sure that opioid addiction in our community has been removed. Thank you very much for allowing me to speak on behalf of the City Council. God bless you all.
One person I like to bring up, he's not new to the city. He's been around for over a year, but he has hit the ground running and really is taking a lot on. I'd like to bring up our Health Director, Damone Chaplain, please.
Good afternoon, and thank you all. I really appreciate the support that the Health Department has received through the New Bedford Task Force, Opioid Task Force. This marks the 17th Annual International Overdose Awareness, and I'm going to be brief with my comments. Unfortunately, this past weekend, I was at a family function, a ceremony for a close friend of a family that passed away from substance abuse. This crisis, this challenge, this fight is near and dear to my heart, similar to how I feel about the community of New Bedford. When I took this position, I immediately felt at home and felt like I was in the right place at the right time for the right fight. And I think we're all here in the right place at the right time for the right fight. And so all oars in the water, all hands on deck, and we're going to give everything we got to this crisis. The New Bedford Health Department, our goal in this fight is to improve the way that we approach overdose in New Bedford. And so we're going to be incorporating a clinical approach to our efforts, along with incorporating data and strategic planning going forward. So very soon you'll be hearing some of the things that we'll be doing through the task force and through the health department with the support of the police department, Reverend Lima, and the mayor's office. So I thank you all for being here today, and I look forward to working with you in the future.
Truly, he's taking this bull by the horns, and he's really working together, so we thank you, Damone. Last but not least, and there's no truth to the fact that I might have said something about length of talk because of him, but our chief of police is probably one of the most caring people I've ever met. Law enforcement is first and foremost, and it's been part of his heart and soul for the last close to 30 years. But the one thing that's also part of his whole being is caring about individuals and recognizing that we're not going to arrest our way out of this problem, that we have to have some compassion in what we're doing, and it's only the worst of the worst that are going to be able to, that we have to go after in terms of law enforcement, but there are others that with a little bit of love and care, with a little bit of assistance, can get help. So I'd like to bring up our chief of police, City of One. Notice that the outreach teams, the chaplains, we wear these City of One. That was his, when he got sworn in, that was the slogan he came up with. He probably didn't even know it was a slogan. But for many of us, it became a rallying cry. We truly are a City of One. And Chief, would you come on up and please say a few words?
A few words. Reverend Sergeant, they've never played music for me ever, so I hope it doesn't start tonight. But thank you, Reverend. I'd like to thank Connie, of course, and her staff for doing a great job putting this together. Mayor Mitchell for all the support he gives us from City Hall. The DA Quinn has been incredible as well with us. Tony Cabral, Representative Cabral up at the State House, and all the other state representatives that are not here today, supporting getting funding down here. And of course, our City Council Linda Morad, Council President, and all the support we get from the City Council. So I don't get the music. I'll try to be quick. Today is really a day about a lot of emotions. It's about celebration. Celebrating those who have got on that road to recovery. Those that are still with us and are able to fight. And it's also a day for us to have some memory and memorialize those that have gone, as we see these beautiful pictures of family members that succumbed to the disease and to the fight. Time to remember them, their fight, their families who suffered during that time, and it's also a time for us to support those that are still engaged in the fight, those that are still trying to find a road to recovery, their families that are struggling with that pain and waiting for that knock on the door from a police officer, from the worst kind of news that they can get. So that's what it's about. It's also about a time that we can talk about our future, because I believe our future is bright, especially here in New Bedford. As the mayor talked about, and Damone talked about, and a few others have talked about, we have an incredible city that truly has come together, a city of one, of passionate people that are working effortlessly every day, very hard to make that change. Narcan has been very effective, but the reality is it's been a Band-Aid. It's a bridge to give us another day for that person to try to get on the road to recovery. So how do we stop this madness of overdoses, despite our successes in saving lives for another day? That is the million-dollar question, right? What we do know, and I see a sign here, says repeat at what we don't repair, right? Repeat, I couldn't see the side, what we don't repair. If we keep repeating, we don't have change. We need change, and that's the answer. What is that change? And how do we come across it, right? We've had the war on drugs. Has not been very effective. Why? Because when it says war, we're using the same type of weaponry. Guns, bombs. We need to come up with other solutions. As the Reverend said, we're not going to rest our way out of this. We need other solutions in this war on drugs. As long as there's demand, there's going to be a supply. So we've got to eradicate the demand. We have a group of people that are suffering in that pool of disease with that demand for that drug. And then we have another big challenge of those that are heading towards that pool. So we got two huge issues in front of us that we have to try to reduce that demand, to eradicate that need for that supply. Cuffing them and putting them in jails isn't going to work. Although I do believe putting the drug dealers in jails. If they're peddling fentanyl and they're killing our people, if they're putting them in the ground, they deserve to be in jail. Those that are struggling with that disease, it's an illness. We need to get them the help that they need. How we look at people, that's a change that we can bring. How we look at people. Someone talked about the stereotype. How we look at people, we need to stop judging them. I seen something earlier, we need to start looking on the outside and looking on the inside. Up here you see somebody with a uniform. Behind you, the gentlemen that are playing for us today, you see him in a uniform. But all of us, and beyond that, we need to look on the inside of people. There's a person in there suffering that needs our help. We need to stop judging. And when we stop judging, then we start to find solutions on how we can help those people. These people, our friends, our neighbors. Love, kindness, and caring, and helping others through this struggle. That's the change that we need. And I ask you for that change. And I'm a man of quotes. I love quotes. And I'm almost done, Sarge. Peter Senge, he says, and I quote him, "When all is said and done, the only change that will make a difference is the transformation of the human heart." And that is true. Which leads me to my next quote with John Lewis. If not us, then who? If not now, then when? And that is true. If we don't start addressing this together as a community, as a city of one, then who's going to do it? We cannot rely for government, for the federal government, to solve our problems. Although they're working on it, and we could use their money, but us now, we have to start to talk about how we can make these changes. And of course, I'm almost done, I promise you. Thomas Jefferson says, do you want to know who you are? Do we want to know who we are? Don't ask, just act. Action will delineate and define you. And that is true. Time is now for us to act, to do the best we can every day from our perspective, from our walk in life. To be the agent, and this is my message to you, to be the agent for change, to be the antibodies to rid our society of current ills and this disease, we must love unconditionally, as humanly possible, through our thoughts, and more importantly, our actions. That is so true. And I end with this, my friends. I thank you for being here today. I thank you for what you do, but more importantly, I thank you for what you're going to do going forward. I wish you, your families, a great life, memories, and the changes that you seek in your own lives, in your neighbors, and those that are struggling. I wish you happiness and that you find love in the road to recovery and the support that you need. May God bless each of you, touching your hearts, your minds, and giving you the courage to bring this change to our beautiful community, a city of one. Thank you.
You know, I'm the Pentecostal preacher that's up here, but I'm telling you, there's a closet preacher in you, Chief. There's a preacher in you trying to bust out. Can I get a hand for all our speakers? Truly, this is a great team. We are going to have a moment of silence for those that have passed. We're also going to, as we stand here with the flag at half-mast for a great American hero, whether you like the politics or not, nobody can deny that Senator John McCain was a great man who did a lot of great things in this community, in this country, and has always tried to do his best. Whether you followed his politics or not is irrelevant, because he was one of the only folks that ever tried to cross the aisle and had no problem calling out his own party. We lost him this week, and we lost his leadership. In honor of those that have passed, in honor of John McCain, the Massachusetts State Police Pipes and Drums are going to be performing Amazing Grace. When they are done, we are going to start walking.
Hi, I'm Taya Leone, and you're watching New Bedford Cable Network. Good for you.